Fexofenadine drugs information. Generic name Fexofenadine. Drug class antihistamine. Second generation. Brand name Allegra. What is Fexofenadine? It is an antihistamine that reduces the effects of natural chemical histamine in the body. Histamine can produce symptoms of seizing, itching, watery eyes, and runny nose. Fexofenadine is used to treat allergic symptoms such as high fever, seasonal allergic rhinitis, and urticaria, chronic idiopathic fevers. Vital information: active ingredient Fexofenadine hydrochloride. Forms: tablet, disintegrating tablet, oral suspension. Strengths typically available in 30 mg, 60 mg, and 180 mg tablets. Before taking: 1. Allergies. Inform your doctor. If you are allergic to Fexofenadine or any other medications. 2. Medical conditions. Disclose your full medical history, particularly kidney disease. 3. Pregnancy and breastfeeding. Consult with healthcare provider if you are pregnant, planning to become pregnant, or breastfeeding. 4. Other medications. Provide a list of all other medications you are taking, include over-the-counter drugs and supplements. 5. Age considerations. Not recommended for children younger than 6 months old. Geriatric patients may be more sensitive to side effects. How to use. 1. Read instructions. Follow the prescription, label and medication guide. 2. With water. Take the tablet with water, not with fruit juice like orange, apple, grapefruit juice, which can decrease absorption. 3. Disintegrating tablet. Allow it to dissolve on your tongue without chewing. 4. Measure liquid form. Use a proper measuring device for the oral suspension. Dosage information. 1. Adult and children 12 plus years. Typically 60 mg twice a day or 180 mg once a day. To children 6 to 11 years, usually 30 mg twice a day. 3 children 6 months to 2 years, dosage is determined by the doctor, typically 15 mg twice a day. Miss your dose. If you miss your dose, take it as soon as you remember. If it is almost time for your next dose, skip the missed dose. Do not double up to catch up. Overdose. In case of overdose, seek emergency medical attention. Symptoms may include dry mouth, dizziness, and drowsiness. What should avoid? 1. If allergic, stop taking if you experience severe allergic reactions such as rash, itching, swelling, severe dizziness, or trouble breathing. 2. Interactions. Avoid taking with fruit juice or anticides containing aluminum or magnesium with 15 minutes of taking Fexofenadine. Side effects. 1. Common headache, back pain, cough, fever, dizziness or stomach upset. 2. Serious, severe dizziness, trouble breathing, rash, itching, swelling, especially of the face, tongue, and throat. Other drugs will affect. 1. Anticides. Anticides containing aluminum and magnesium may decrease the absorption of Fexofenadine. 2. Ketoconazole and erythromycin. These drugs can increase the level of Fexofenadine in your body. 3. Fruit juice can decrease the effectiveness of drugs. Thank you. Have a nice day.